In the initial case of the facility's closure was attributed to scarcity of essential medical consumables required for dialysis. When dialysis medical consumables were finally procured, the service saw an unprecedented increase in fees from 380 Ghana cedis to 765.42. Mr. Speaker, the hospital's public relations officer explained to the general public that this alarming price adjustment was as a result of the government withdrawal of tax exemptions, leaving the hospitals burdened with the full cost of importing vital medical consumables for dialysis, leading to unexpected financial strain. The hospital therefore had no option than to increase dialysis fees to cover part of the cost and render the service unsustainable in the long run. Mr. Speaker, as of now, there has been no official communication as to whether the duties paid to expedite the clearing of dialysis medical consumables have been refunded. But even more interesting is the fact that the hospital owes suppliers of dialysis consumables about 4 million Ghana cedis, which is making it very difficult for the hospital to secure these consumables. Mr. Speaker, I plead with this House to rally behind me in calling on government to consider absorbing the full cost of dialysis for Ghanaian patients, or at the very least, absorb whatever the difference beyond the 380 Ghana cedis. This will help alleviate the financial strain on patients and ensure timely access to life-saving dialysis treatment.
Speaker, on the NHIA absorbing these costs, things are an interesting call. And thankfully, the President's Excellency has also given his blessings and support to this call. Here, I'm told the stakeholders are engaging on this matter. Again, the Health Committee would have to play a role, and I will plead with my ever-passionate ranking member to liaise with the chair and see what they can do about this for us to come atop this matter.
This issue also brings to the fore the issue of bureaucracy, especially when it comes to bringing items to the port and trying to clear it, items that are obviously going to save lives. I'm sure members of parliament here have horror stories to tell about trying to build medical equipment to a hospital and the nightmare of trying to clear it from the port, when it's obvious that it is intended to save lives. And that has happened so many times. You bring books for schools and you end up just paying for it. You bring medical equipment and you know that you would never try it again. We must really get the revenue authorities to draw that line and make sure that when it comes to equipment that are as critical as helping facilities in terms of saving lives, renal care, these are things that they must fast track and clear. I'm sure those are the root causes. How many people could afford overnight an increase from 380 Ghana cedi to 760 Ghana cedi? And that really was a problem.
Is to appear before us on Thursday, 9th of November 2023, to come and brief us on the closure of the renal unit outpatient department and the upsurge of kidney-related problems in Ghana. I mean, the minister should come and tell us something. Almost everywhere, people are talking about the kidney-related problems. He should come and tell us if the NHIS issue can also be captured in relating to kidney-related issues. I mean, he should come and tell us and to the extent the whole nation. So that is my directives.